Good afternoon, everyone. Welcome to Cook County Health Department's School Health Update. My name is Kelly Jones. I am a health educator senior with Cook County Health Department, and I also facilitate these school meetings. Welcome. It's so good to see everyone. Glad that you could make it. Let's get started. Our meeting objectives are to share updates, information, and resources to help schools navigate school health issues, answer any frequently asked questions, and provide CCDPH contact information and resources. Our webinars are recorded and they're all uploaded to our CCDPH YouTube page as well as our website. Please keep your lines muted. We don't want to interrupt anyone from hearing the information. If you have any questions or concerns, feel free to put them in the chat and a member of our team can answer those questions, or we will answer them during the Q&A portion later on. Our agenda today, keeping with the love theme, even though it ended a few days ago, we're going to have a couple announcements and resources. Our communicable disease team is going to offer an update. We're going to have a vaping presentation from our tobacco unit and a presentation on school violence prevention from Chief Mitchell Davis, who is the police chief of Hazel Crest. Let's get started. Few announcements for our March meeting. Our communicable disease unit would like to talk to you about immunization data and how to put that in practice for schools. So some helpful tips for schools who may be struggling to know what to do with the immunization data that they receive. Uh-oh, my slide stuck just a little bit. As I mentioned in previous meetings, thank you to those who have already volunteered. But our CCDPH School Health Advisory Committee, which only meets on a bi-monthly basis unless we are in the midst of planning a large event such as our previous in-person event, we are in the need for a few committee members. We lost a few due to some retirements and some job changes. Thank you to people who have reached out. But if you are interested in lending your voice and you're not shy to share that voice, feel free to reach out to me and I can put you in touch with our notes and information and answer any more questions about the committee. I appreciate that support of our committee. If you need to contact CCDPH, our general email line is the Healthy Cook at Cook County HHS email line. If you'd like to report line list or send any information to communicable disease, there's a specific email address, which is ccdph_schools at cookcountyhhs.org, as well as here is information on our Cook County Health Department website, school-specific website, and some COVID resources. Information on our Cook County Health clinics. You don't have to be a patient to a registered patient to go to the clinics. They accept walk-ins. They accept you if you aren't unable to pay. You may go to any of the clinics for reasons, and they can resource you out to other facilities based on your needs. So it's a wonderful resource that the community can take advantage of if necessary. Here's information on 2 vaccination clinics that will be at our Cook County Health clinics. No appointments are required. It is open to the public. Insurance is accepted, but it is not required. For more information on the details of these clinics, you can go to our Cook County Health calendar, and there's a pop-up once you hover over the calendar dates, and it'll give you all of the information on these upcoming clinics, as well as information on other events that are sponsored by Cook County and some of our partners. I've heard from several community partners that some nurses could probably use some professional development and maybe some help with computer skills. You are in luck because Cook County Health Department, in partnership with the Illinois Public Health Institute, are producing several professional development trainings, as well as 2 in-person computer trainings. They're completely free. The computer trainings are held at Moraine Valley, and there are also some other professional development trainings. I believe there's one coming up this Tuesday on burnout. So the link will be on the flyer. I shared that once before, but I'm sharing it again because I want to make sure that everyone is aware of that. And you can take advantage of that. And if everyone from your staff can't go, maybe send one person and they'll be the person who can take that information and share it. I hope that you guys can make good use of that. Information on EpiPens and albuterol. I am the point person for the EpiPen and albuterol. You can give me an email if you have any questions or concerns, or would like to request a standing order or a prescription from Dr. Joshi, who signs that. Just make sure that those requests are typed and attached to requests, no links or any drop boxes or anything like that I cannot access. Thank you. And in addition, for those who have requested for years and years and you're well aware of the process, there's a new process that started last year. For those who aren't aware, you now have to fill out the form on the slide to attest who in your organization has been named and trained to administer medication in the event of an emergency. So I will attach both of these forms and make sure that's all submitted with your request in order to process those requests. Here is just some resources on obtaining EpiPens and securing albuterol training for those who have asked. I just added it to a slide. For schools who are automatically opted into the Rescue Illinois albuterol program, you will receive the materials automatically. I get a few questions going, we got this material, we don't know where it came from. That came from the Rescue Illinois program because you're automatically opted into the program because your district fit those metrics. If you have any questions about that program, you can email Naomi Soto, whose information is on this slide, and she can give you more information on the standing operating procedures, standing orders, and prescriptions for this program. If you're not enrolled, feel free to reach out to Cook County Health Department to receive albuterol prescriptions. And here is some information on some upcoming asthma programs from the Respiratory Health Association. These are free. For questions regarding Narcan for your organization or Narcan for schools. And I know there are a lot of questions coming up regarding these prescriptions and standing orders because the new law has dropped. You can contact Denise Holman, who's the point person for that, and Denise's contact information is on this slide. I'll be happy to forward any emails that I received to Denise regarding that if you sent it to me by mistake. And here's just some resources on Cook County Health Department's Boost Up campaign because we want to still continue to let people know that it is still flu season, it is still respiratory health season, and we want to make sure everyone is boosted up. And that's not just from your COVID vaccine, your RSV vaccine, flu vaccine, any immunizations that you may be down on, we can help you to find the resources to get that vaccine up to date. And you can find all of this information on our website, as well as you may be able to go to covidtest.gov to receive 4 tests for home use. There is no limit to how many times you go in to request those, as well as you can request antigen kits for in bulk for schools from Cook County Health Department. And the link is also in this slide, as well as we are still, as long as we have them in stock, filling PPE requests for organizations. So that link is also there. And I'm still urging people to use the mobile vaccination resources that we have gathered. I had some schools reach out asking me about that. This is the time, because they get incredibly busy, to reach out to them now to request them to come for your summer program, for your fall back to school program, because their calendars book up incredibly quickly. So please utilize the resources that are at hand if you need that for your district or your school. As well as IDPH has a wellness band that you may be able to book for your summer or back to school events as well. A few additional resources that we received from our emergency response department on some pediatric disaster response training, as well as the American Red Cross has a pillowcase project for disaster training for schools. You can, I put the link inside the slide, and you can reach out to these organizations to secure them for your school and just get more resources for much needed time. Also, here's a few resources on some mental health resources that are out for 988. For you can call you can go to NAMI that has special resources, as well as call, text, or go online for 988, as well as 211, which we are trying to raise more awareness of. 211 is similar to 311 and 411, 911, except it's just for resources and it's nationwide. So you could be calling for your grandmother that lives in Florida to ask questions about resources within this zip code. So it's a nationwide hotline. And I'll just slide through other resources that we have. And here is one slide page with just all of those resources that I linked if you would like to reference it and just keep it for that one slide. And I want to thank you for your attendance. And I am going to toss it to Lex for a communicable disease update. Welcome, Lex.
Thank you, Kelly. Everybody bear with me for just 1 second while I get my slides pulled up. All right, so for those of you who don't know, I'm Lex Berta. I'm an epidemiologist who works in the communicable diseases unit at Cook County, and I'm going to give you just a brief overview of where we're at in the respiratory season. And, a lot of people have asked about GI illnesses as well, so GI illnesses as well. So, brief overview in our agenda. I'm going to talk about COVID-19, which is somewhat stable. I'm going to talk about flu, which is picking up a second wind, GI illnesses that are decreasing but still kind of elevated. And then, as Kelly mentioned, next week, not next week, the next session, we are going to be talking about the vaccine data that you guys have all collected on your schools. We'll, show maps, show you what our county is looking like, how covered we are. It'll be really interesting. I'm excited for that one. All right, so getting into it, where are we at with COVID-19? We are relatively low and we're kind of stable, but we're still higher than we were in the warmer months. Hand hygiene, respiratory etiquette, really important. And then if you do have someone who's testing positive or starts to develop symptoms, they need to be staying home for 5 days. And then when they return to school after not having a fever, for at least a day without taking any kind of fever reducing medication, then they have to mask through day 10. So that's the best practices. I know it can be kind of a struggle to enforce that, but that's still where we're at here. For influenza, we're kind of back to what we were used to before the pandemic. We usually get a bit of a second wind around February, and it's usually we see more of influenza type B, which is different from, like H1N1 and other things we see earlier in the season. We're still seeing more of those type A's, but we've got more type B coming up. And recently we've seen an increase among school age kids, age 5 to 17, as you can see in the circle, kind of a sharp uptick there, and they're driving it. If you look at the bottom graph in red, that's our current season, and then the lighter blue is what it looked like before the pandemic, and the darker blue is a pandemic season. So you can see we're kind of shifting back to what we used to look like. Flu guidance is the same as it used to be before the pandemic. Stay home when you're sick, only return if you've been fever-free for at least 24 hours without the aid of any kind of medication. And that goes for RSV and other things like that. I don't have RSV data to show you because of the Lurie's hospital issue with getting data, but that's no problem. It's been going down steadily since earlier this year, so we're in a good place for RSV. For GI illnesses, it is still stomach flu season. It's decreasing, but it's still elevated. Hand sanitizer and alcohol-based cleaning products aren't enough when you're dealing with norovirus. It is persistent. So you need to be enforcing hand hygiene and encouraging bleach-based cleaning. I'm sure your maintenance staff already know that. And then, of course, students should not be in school within 24 to 48 hours of vomiting or diarrhea. I know parents aren't always great about that. So again, IDPH has some like example letters on their website that you can send home. But you can see in the graph here that we're kind of where we expect to be at this point in the season. People are going to be getting some norovirus, but it'll start clearing up once we get further into spring. All right, that's everything I have for this. Thank you so much for letting me share, Kelly. And then I'll be on the whole time if anybody has any questions in the chat.
Thanks, Lex. We appreciate you. I love your graphs. And I would like to welcome the the CCDPH tobacco unit that is going to speak to us regarding vaping in schools. It looks like Neela will be doing the presentation. Welcome, Neela.
Thanks, Kelly. I will also be sharing my slides. Thank you all. Again, my name is Neela Satyanarayan. I am not sharing the way I want to. Okay, sorry, 1 second.
I can see
I'm
him.
okay. I,
Okay.
I I don't love the live in Teams. Sorry, I'm just old school. Here we go. See if it'll go into presenter mode. There we go. Um, I'm the program coordinator for our tobacco prevention and control program here at CCDPH. And we wanted to just speak for a few minutes about the role of schools in preventing youth tobacco use. Our program works with partners to reduce exposure to secondhand smoke, inform the public of resources that are available to help quit and prevent youth from even starting to use tobacco products, vape, smoke, and to help eliminate tobacco-related disparities. We receive funding from the Illinois Department of Public Health through the Illinois Tobacco-Free Communities Grant, and we implement tobacco prevention and control initiatives, including educational campaigns and cessation-related interventions. Cessation efforts are statewide and have become a really important focus for IDPH and tobacco programs throughout Illinois. So part of what I want to present today is to discuss a few best practices for schools related to policies to have smoke and vape-free campuses, to provide resources for school administration, as well as resources for parents and students. So we know tobacco use is a public health concern and still remains so. It is still the leading cause of preventable death and disease in the United States. In 2022, more than 2.5 million US middle school and high school students stated they currently use e-cigarettes. They're seeing it on social media, and most youth report using flavored tobacco products or a flavored product. And the flavors, as you've probably heard, are easier to start using, like menthol, and then harder to quit. So a few of the best practices we want to discuss to give you a bit of background on some policies that are currently in place. In the United States now, the age to buy any sort of tobacco product is now 21. So the legal age to purchase tobacco products increased from 18 to 21 in December 2019. And in Illinois, each school board can prohibit the use of tobacco on all school properties by any school personnel, student, or person when such property is being used for any school purposes. Now, what complements that as well is the Smoke-Free Illinois Act this year, passed last year, but went into effect January 1. The definition of smoking was amended to include electronic cigarettes. So the Smoke-Free Illinois Act prohibits smoking indoors in pretty much all public places. And now the definition of smoking includes electronic cigarettes. And recently as well, the Cook County Department of Public Health amended the Cook County Youth Tobacco Control Ordinance and went into effect mid last year, and flavored liquid nicotine products can no longer be sold in unincorporated Cook County tobacco retail stores. So that was a great win for us, a good step in the right direction, but these are some of the current laws and policies that are already in place. So some of the implementation strategies for schools that can help with decreasing and preventing youth tobacco use is involving parents and families in the school's efforts to prevent the use. We also want to ensure that the policies are comprehensive so that the language definitions include non-combustible products like e-cigarettes, um, flavored tobacco products. And so it's a very comprehensive definition. So it can include all the different types of products that are on market, which are a ton now. We want to provide, tobacco prevention curricula for students and staff, and evaluate the school programs at regular intervals and make sure that they are using, the most up-to-date information. And a few types of enforcement ideas that, is encouraged is communication. So we want to ensure there's proper signage around the campus, all around the school grounds, and that information is sent home regularly to parents about use of vaping, tobacco use, as well as resources to help parents talk about vaping, cessation resources, any sort of information that'll help with talking and quitting. And within the schools, we want to be supportive. We want to provide support for students instead of doing disciplinary actions. So suspensions can potentially cause even more problems. And so there are other ways to address tobacco using students without going in, a severe disciplinary route. Now, some of the resources that we have, this is not comprehensive. We just wanted to provide examples of potential resources. And then you can always contact us to receive more information or guidance about any of the resources we share. And we can also connect you with the partners as well as other resources as needed. So one of the resources that we recommend for schools is the Tobacco Free Schools Toolkit from the American Heart Association. It's a great comprehensive toolkit that includes model policy language that can be adapted for your school or your district, student code of conduct language, sample letters that can be sent, that can again be adapted to be sent out to parents, caregivers, various prevention programs that are available, as well as cessation support. And a few other partners. So CCDPH, the Department of Public Health, we partner with two great partners here in Cook County, American Lung Association and Respiratory Health Association. American Lung Association has a Train the Trainer program called Not on Tobacco. And it's a training for facilitators to deliver a program about cessation with teen smoking and vaping. And respiratory health offers technical assistance to support school administration to develop tobacco-free policies. So both great partner organizations that can really help move policies and education. And a few resources that are available for parents and students. We like to encourage parents to think about, how they act and the values that they communicate through their words and their actions really have an influence on their children. So if you don't smoke, don't start. And if you do, we always encourage people to quit and offer cessation resources. Maintaining a smoke-free home by not allowing anyone to smoke inside. This makes it less convenient for smoking, and it also sends a strong message that it's not desirable and hopefully not a norm. And as well as talking to your kids, we want them to understand the immediate effects of smoking on physical appearance, their mental health, their emotional health, their physical health, and understand that, not everyone smokes. I think, kids think that a lot of people smoke because they may see it around them, but they may overestimate the amount of smoking amongst their peers. And there are also great resources out there related to quitting cessation resources, information, counselors, etc. So one great resource is the Illinois Tobacco Quit Line. They have free resources to help people quit smoking, vaping, other tobacco uses. If they're also can provide free nicotine replacement therapies, patches, based on your eligibility. There is also, you can text quit to this number here to receive text messages specifically for parents to work with their with kids who use vaping products. We have, there's also My Life, My Quit, which is a newer program that is for teens using, smoking or vaping. They can text, they can sign up online, they can call, 24/7 service there, which is great. Another option is smoke-free text, the Quit Start app. So a lot of great resources out there. And again, this is not comprehensive. We want to provide you a sample of what is potentially available for both parents, students, and schools. And like I mentioned before, we're here to help connect you with resources, walk you through options, provide that technical resource, and also connect you with additional resources and our partners. So Aisha Binion is one of the educators on our program, so feel free to reach out to her with any questions about any of the information I presented today. I think Kelly will be sharing these slides to the group, and they'll also be available on our website with the recording of this meeting as well. So if you have any questions, I'll be on the meeting for the rest of the meeting, so feel free to put them in the chat and I will try to answer them. Thanks so much.
Thanks, Neela. I learned some new things. I didn't know that the smoking age had gone up to 21. I don't smoke anyway, so that's why I didn't know, but that's good to know.
Yeah, and actually Illinois, Cook County, and Illinois passed it before it went out on a national level. So we were actually on the front end of that, which was really great.
That's fantastic. That's a win. There are a couple questions in the chat. I will just review them. One question about slides. Yes, the slides will be sent to all registered participants, and the recording will be uploaded to our YouTube page as well as our Cook County Health Department website for viewing later. I know a lot of people can't join live and they view them later. Maybe they have trouble sleeping and they want to just give themselves something to do. I don't know. They like to hear my voice, but you can view them later on. There's one more question for our communicable disease unit is, does CCDPH or IDPH have general sick day guidelines, i.e. what symptoms warrant a student to stay home? I know IDPH has their communicable disease chart, but I'm looking for something that's just based on symptoms before the parent takes the child to the doctor. I don't know if Lex or Michelle would like to answer that.
So I'm looking for the actual written documentation, but I was just typing up in the chat. Just in case you need the written documentation, I'll get that out there. But off the top of my head, like extrapolating from what the chart and list say, fever or signs of fever like chills, vomiting, diarrhea, conjunctivitis, since that can be so contagious, and skin lesions. Without knowing what any of those are from, those would be the ones where hopefully common sense would prevail and you would keep your child home if they had that. But those are the big ones to look for. They'll be different once you actually get a diagnosis and will vary, but those are, without knowing what's going on, those are things to look for. And I'll keep looking for the guidance in the CD code.
Sounds great. Thank you so much. If there are any other questions, feel free to put them in the chat, as well as our upcoming presenter who asked that any questions that you have, because he wants to make it very conversational, put them in the chat. I will monitor and then we could ask questions. But that leads me to introducing our upcoming presenter, which is Chief Mitchell Davis, who is the police chief of Hazel Crest. Chief Davis is so accomplished, it's hard to pick out a few of his accomplishments, but I'm going to try, Chief. I want everyone to know how great we are and honored to have you. He's been the police chief of Hazel Crest for 14 years. In 2022, he became the first person ever to receive the NFL Association's Law Enforcement Man of the Year award for his work with their child identification program. He is currently the 2024 candidate for the second vice president for the National Organization of Black Law Enforcement Executives, NOBLE, where he served as their recording secretary previously. He is a past president of the Illinois Association of Police Chiefs from 2021 to 2022. And Chief Davis was also appointed by Governor Pritzker to serve as a member of the Illinois Law Enforcement Training and Standards Board, as he was elected to membership as the chair of the board, also the first person of color to do so. He was also appointed by Governor Pritzker to the Illinois Commission on Discrimination and Hate Crimes. Chief Davis was also appointed to the Regional Advisory Committee for implementation of Illinois' 988 Mental Health Crisis Community Emergency Services and Support Act. And that is just a fraction of his bio, and we are so lucky to have you. Welcome, Chief Davis. The floor is yours.
Thank you, Kelly. Am I coming across okay?
Yes, we can hear you great.
All right. Good afternoon, everyone. As you just heard, my name is Mitchell Davis. I'm the police chief in the village of Hazel Crest. And Kelly asked me to come on board and to speak to you all today about school violence. So I don't have a PowerPoint. I have a big mouth, so I'm just going to talk. You'll come to learn that. But what I kind of want to do is I want to cover some, I guess, everyday concerns, just tap on them. And then I want to kind of bring home an area that we're trying to really focus on as it pertains to violence, both in school and outside of school. So just a little bit additional on me as it pertains to schools. Here in the South suburbs, I'm sure some schools have SROs. Most of the schools, a lot of the schools in the South suburbs have what's called police liaison officers. What's the difference? An SRO, school resource officer, is somebody who is an officer for the police department and they are assigned to the school. Their job is to work at the school. They're paid by the police department. A lot of times the school reimburses the police department, but that's their job as an officer. They don't patrol the streets, maybe during the summertime or when the school's on break or something. But other than that, they're assigned to the school. Police liaison officers are police officers, but that's working in the school is not their primary job. They can be retired. They can be a side job for them, but they're police officers that work as contract individuals in the schools. And so I did that here in the South suburbs at several of our high schools for almost 30 years. I've been in law enforcement for 30. Am I going to my 33rd year, 15 years total as a police chief? But throughout those years, I've worked in high schools. I love working with young people. Both even before I came into law enforcement, I work with young people, but they're very near and dear to my heart. And with the gifts that I've been blessed with now and the opportunities that I've been blessed with now, I often advocate for our young people, both from a victim standpoint and an offender standpoint. I'm on the board of directors for the International Association of Chiefs of Police, and I'm also the chair of their Juvenile Justice and Child Protection Committee. So once again, kids are near and dear to my heart. So having given you a little background, I talked to about SROs in school and police liaisons, and I'm an honest person. Give real talk. Whatever your feelings are on police being in the school, SROs or police liaison officers, whatever they might be, you have to make sure that you have the right person. Just because they're a police officer doesn't mean they need to be working with kids. An SRO or a police liaison officer is only as good as the people as you pick. You've got to get the right people. There's got to be some vetting process to make sure that you've got somebody who's not just there trying to get a side check or trying not to have to work midnights in patrol, but there's somebody who truly are able to relate to young people and are willing to understand that while you're there to protect the school, you're not there primarily for enforcement purposes. You're there as to be a part of the community and be a part of an environment. So often, and I've seen it personally. I've worked alongside people that got no business working in the school. They are horrible. And once again, I'm an honest person. They do a horrible job with relating to people in general as an officer, and then you put them in an environment where there's thousands of teenagers running around every day and being teenagers, and they think that they're on the street, and they end up having bad interaction. So that's not a winning formula, and that does not help to make the environment at the school safer. I've heard teachers and people that work in schools, administrators, often talk about how sometimes they feel scared of the kids that they are responsible for. And what do I mean by that? You know, you all are close to these kids. You're with them oftentimes more than their families. You're with them for so many hours and for so many months out of the year that you know who the challenged young people are, and you know that this young guy or this young girl just shot somebody and was in jail, and now they're back in school sitting in your classroom. And I've had educators, people are working in schools, tell me that they're fearful of their safety, and that in itself is not that's not a police issue. That's a school issue, and that's a systemic issue whereby we have to make sure that we are absolutely taking care of even challenged young people, that we're taking care of them, but in the same time, we cannot compromise the safety of others, whether it be adults or other kids, for the sake of making sure we're looking after them. Now, that's something I can get on my soapbox and talk to you all about. I'm not going to do that today, but that's something, it needs to be, things need to be done equitably so that we're taking care of everybody. Outside threats are a major issue. People who don't belong in school causing harm in school, whether it be on the perimeter of the school. We've heard about those instances that just happened in Chicago just recently, and also people entering into the school space and doing things. So those are systems. Once again, they're systems that we need to make sure that are in place, and we've got to look at best practices and also lessons learned as far as well as how we look at those things and how we make our school environment safer. We need to have people come in who have had experiences to talk to people who are in the school and gain their input to find out what concerns you have, what things are you seeing, and what things are you fearful of, so that they can be addressed head on, and it's not just somebody guessing as to what you might want to have. The greatest thing about a school environment, or the greatest asset about school and the school environment, is everybody talks. It's a community. The kids know what's going on. They know who's got a gun in school. They know who's got drugs in school. They know who's about to fight. They know who's going to come up there looking for somebody. They know who's going to fight after school. They know these things. That's why it's so important. It's essential at all levels in our schools that we are creating an environment of communication. I've had people kids come to me working in school. They ask for a pass from the teacher to go to the bathroom because they don't want kids talking. And they'll come and they'll find me in the hallway and say, "Hey, there's so and so's got a gun in his locker." I've had that happen before. That we've got to make sure that we're fostering an environment of communication to not jeopardize those who are willing to communicate, while at the same time making sure that they feel open to come to us and share with us those things that they know. Because once again, they know what's going on, and we've got to make sure that we're tapping into that asset. So I just wanted to touch on those real briefly, but I want to kind of spend some time on some work that I personally am doing around youth violence. I know the subject matter is school violence, but as far as I'm concerned, youth violence ultimately ends up being school violence. And program that we've started here in Hazel Crest and in this Southland area, started thinking, okay, we bring together all these stakeholders, and youth violence is out of control. It's out of control, and some of the most violent offenders repeatedly, they're getting younger and younger. They're not the 17, 18-year-olds like we used to. They're the 12, 13-year-olds, 11-year-olds that are out there shooting people, carjacking people, and it's happening on a regular basis. So trying to think outside the box, trying to be innovative in how we do things, tried to come up with an idea that, hey, instead of us as adults with all these resources, with all these well intentions, these great intentions, trying to come forward and trying to help young folks, how about we ask them? And so what we've started to do, we actually got a little grant money whereby we're doing youth violence listening sessions, where we have youthful offenders, young people who have committed harsh offenses, who have been in the criminal justice system, who were in the criminal justice system, who've been addicted to drugs. We have them coming and they sit with us as stakeholders and they share with us, how did I get there? How did I get started doing with violence? What kept me doing violence? How did I get addicted to drugs? What were the circumstances? What may have stopped me from doing that? So we hear from them, and we don't just have them talk to us about what's going on. We get that information and we utilize it as stakeholders to try to help them to come up with systems and programs. But at the same time, we're offering them resources. We're offering them counseling. We're offering them mentorships. We're actually offering them stipends. And we're trying to show them that what they bring to this table is valuable. I've always said that the difference in people and communities between doing illegal things and doing productive things is opportunity at the end of the day. We've got to provide opportunity. And is everybody who's got opportunity for good options going to take advantage of them? Absolutely not. But if they don't get opportunity for good options, they will never take advantage of them. So we've got to make sure that we're providing opportunity. So for us, this is a program that we've implemented, and we've been working with it for about 6, 8 months now. We've got our local high schools, our local grade schools. We got social services. We got prosecutors. We got defense attorneys. We got judges. We've got everybody at the table. We got educators at the table to help brainstorm and come up with solutions to try to do what we can to look at the root cause. Then talking about root cause, something that I have mandated my officers to do, especially my detectives, something that I started to do a few years ago. Like I said, youth violence is out of control. We've had viral videos here in the village of Hazel Crest where you got young people in a park with rifles in the park where next to the swings, and they're out there videoing themselves and putting it on social media. What I started doing is when we come across offenders, whether we have arrested them or whether we just suspect that they are an offender and we can't prove it, I personally, as the chief of police, go to their houses. I speak with their parents and I let their parents know that, hey, I care about what happens to you. I care about what happens to your young person. I'm coming here to let you know, to offer up any resources that we may be able to avail to you. Now, I'm coming to you now to offer up resources. If you don't avail yourself to these resources and your kid keeps doing what they're going to do, then there's going to be consequences. And it won't be, once again, opportunity. It won't be because you didn't have an opportunity to avail yourself to resources. And what I found is that oftentimes there are parents and grandparents who are literally being held hostage by their kids. They have kids that are making very bad and dangerous decisions. They got other kids in the house that are not making bad decisions, and they're trying to protect those kids, but they're literally being held hostage. I had one mom tell me that she says, when my son comes home, she says, I hate to say it as a mother, but she says, oftentimes I wish he wouldn't come home. She says, I got 3 other kids that are doing right, and they're his younger brothers and sisters, but when he comes home, I don't know what he's going to bring home. Is somebody going to shoot our house up because he did something to them at their residence? Am I going to get targeted? When my younger kids go to school, because they're his brothers and sisters, are they going to get targeted? And so we found that out. My detectives go and I asked them to start developing these same relationships with these parents. We have a parent whose son, he is 12 years old, and he's a habitual car thief. And I mean, and I say it laughingly, but it's the truth. We have some young folks that steal cars like they're Ubers. That's their Uber. Especially when the Kia thing came out, when all they needed was a USB port, they were stealing cars like that's their Uber. If we already know that if we recover a car in Hazel Crest that's from another community, that if it hasn't already happened, another car is going to come up missing because they use that car to get to Hazel Crest and they got to get back to where they came from. So they're going to steal another car to get back. We've got one mom that one of my detectives has become close with. She called him at 2 o'clock in the morning. And she says, my son is not home. She says, I kept checking his room, and I went back this last time and he's not in his room. She says, and he's in a stolen car. And he's like, well, ma'am, if he's in a stolen, how would you know he's in a stolen car? And you said he's not at home. She says, I'm tracking his phone and he can't ride a bike 60 miles an hour. So he's got to be in a car. and knowing my son, he's in a stolen car and this is where he's at. So having those relationships helps us to help those families and help those young people. Got a grandparent, a grandmother who's raising her grandson. And I don't know if any of you all remember years ago, there was a young boy in Chicago named Yummy that ended up getting killed. And there was a story about Yummy where they talked about how the system failed him. He was like 10 years old, but Yummy was a terror. And 10-year-olds don't just wake up that way. And they did a story on him talking about how this family and the systems just failed him. We have a version of the Yummy that lives in Hazel Crest, and he's being raised by his grandmother. And she came, I had that meeting with her, and I met with her, and she called me up and she asked me to come over to her job. She didn't ask me to come to her house. She asked me to come to her job. I met her at her job, and she just talked about how when I leave work, I go home and I lock myself in my house. Me and my husband lock ourselves in our home because we are scared because their house has been shot up several times because of the things that their grandson is doing. She called us one time, and her grandson had been locked up for attempted murder in another South suburban town, and he was about to go before the judge the next day. And so my detectives went to court because most oftentimes, especially 11-year-old, they may or may not get held. They may get put on electronic monitoring or something to that effect. That's a whole nother conversation. But there was a great possibility that he was going to be released. My detectives went before the judge the next day and shared with the judge that we've got 10 different instances that this young man was a victim, but his victimization was due to these other things that we believe, we can't prove, but we believe that he was involved in. And they shared those things with the judge. And even though they weren't formal charges, that insight that we were able to give to the judge, my detectives were able to give to the judge, was something that the judge had never heard before, and thanked my detectives that I didn't have that background. All I had was that he was with a group of people and he's saying that, hey, I didn't have a gun. These other people had the gun. And this 11-year-old kid that looks like they're 8 years old is standing in front of me. I was probably going to let that kid out. That kid has been locked up since almost last year this time. The crime that was involved in that community has almost been eliminated because that one 11-year-old was wreaking havoc on the community. But I know that 11-year-old goes to school. So you all deal with him in school. So, we've got to make sure that we're doing everything we can to get the resources that we can to help these young folks out because it has to be accountability, but accountability has to come with resources. I just had a conversation with the undersheriff on yesterday for Cook County, and he was sharing with me. They had an event here in Hazel Crest, and he was sharing with me how he had just visited the Cook County Juvenile Detention Center, and he says, "Man, I've never been there." He says, "Mitch, have you ever been there?" No, I haven't. I've been to the building, but I've never been upstairs. He said that people need to know about the Cook County Juvenile Detention Center. He said, it is such a great place. He says, you would think it's just the opposite. He says, but there are so many resources there that while we're so quick to try to say we don't want to hold young people, there are some young people that need to be held, but held not for punishment, but to provide them with the resources that they can't get when they're on the outside. Those kids who are terrorizing their own families and terrorizing their neighborhoods. That he talked about the psychologists that are in there, the medical resources, the mental health resources, all those things that are the school resources that are available in there, and how it can be so beneficial if we utilize it the right way. So for me, youth violence is school violence because these are the young people that you all see every day. And we need to look at the root causes and look at this holistically to make sure that the families are being provided with resources, not just the young people, but the families are being provided with resources because they are the ones that ultimately are being involved with this. Relationship with the police department. There's mixed, some folks that you feel how you feel as far as involving police. But once again, youth violence, juvenile violence is out of control. Well, I have relationship with the schools in my area. When we have offenders that are posting stuff with guns in the park, in town, and things to that effect, I send that information out to my schools. I have a network of folks that in all the schools in the Southland. Who is this? Because they might be in the park district today with that gun, but they might be in school tomorrow with that gun. So I'm not, once again, things done properly. I don't want anything done improperly, but we want to make sure that while we're looking out for folks, we are looking out for everyone. And someone mentioned to me, why are these young people continuously doing these carjackings? Why are they continuously doing these shootings? Somebody brought a theory to me, and I think it has a lot of validity to it. That oftentimes, not just young people, but oftentimes people get addicted to violence. Shooting somebody, carjacking somebody, to some people, that gives them a high. That's a high to them. And if I am doing something and it gives me that rush, it gives me that high, and especially if I'm not getting locked up for it, I'm gonna go do it again. We've arrested young people in stolen car, juvenile in a stolen car. They're getting out dang near every day of the week. They're getting out. They're not getting locked up for that. We've locked up young people. We had an incident that happened last summer where we caught these two young guys in a car that they had stolen from Joliet. They were from Hazel Crest. We caught them here. And while my officers are driving them to the state, I get back to the station and I go back in the lockup, and I see these youngsters there. These were about 12 and 13-year-olds that we had in custody. Hey, you know what? Just finished processing my paperwork so my mom can come get me. We just stole a car yesterday, and we know we're not getting held. So just finish my paperwork, call my mom so she can come get me. That's their mindset. They're addicted to it, and they're with no consequences. That combination of addiction and no consequences is a dangerous combination, and that's how often so many young people repeatedly commit these acts of violence and against people and property. So I know I told you I got a big mouth. I've been going for a while now. I'm going to shut up now and see if Kelly has anybody that's got any questions, any comments that they would like for me to address. I see we got on a few minutes left, so I want to move that way now.
Sure. Fantastic. Thank you so much. I'll say a special prayer for you all because that is a rough thing to have to deal with every day. My mouth is open a few times, like 12. Wow. A couple questions. Is Scared Straight, like the program, still available? And what do you think about that?
So Scared Straight is normally not used, and there have been folks that said that it was not an effective program. I don't know that I agree with that. But it really isn't used anymore. I think that there should be some version because what they say is it traumatizes some people. That program would traumatize some young people, and I'm sure that it absolutely did. But I think that there could be some version, some less traumatizing version of it that might be available because there are those young folks that I think the people that something similar to that it might work for are those young people who are followers. There's young people who, I grew up with this person. I know this person does illegal things. I know they might do illegal, they might hurt other people, but they don't hurt me because I'm their friend, and I can hang out with them and I might not actively participate in it, but what they don't realize is that if something happens and they're with them, that they can be held accountable for that as well. So I think that something like that could be useful. Some version of that still could be useful.
Sounds great. I just put in the chat experience that I've gotten from talking to school staffs. They've seen an increase in behavioral problems since COVID in particular. Is there something that you have seen, and is there anything in particular that schools can do to support themselves, protect themselves, and support students?
So COVID was a game changer for our society in so many ways, and the escalation in youth crime during COVID absolutely took place. And from a behavioral standpoint, you all are the school people are best equipped to deal with that. We only, not always, but we mostly deal with them. With speaking of kids, we deal with them when something has happened. Uh, you all are with them all day, every day, and the people who are having challenges. And I, I would just urge you all to be proactive in providing resources and getting people help, and getting them the appropriate help. And something that I always talk about. I look at everything through an equity lens. It's got to be done equitably, whether you're in Winnetka or whether you're in Harvey. The kids need to be provided with the same resources. And I told you all I worked for 25 years. So one of the school that I worked at had an alternative school on their campus. And I had, I know I've worked in those environments before, but they not just a class, but they had an alternative school located on their campus. And this was some years ago, but it was just kind of mind-boggling. So the town that I worked in as an officer, I was a liaison officer. That was my side job at the school. My real job at the town that I worked in at the time, they had a behavioral school. They had an alternative school that was behavioral based, and in theory, it was challenge kids who had gang involvement, violence, all that kind of stuff. They were put in that behavioral school. Well, I knew that school because it was located in the community that I worked in. I spoke at that school. I've always been a community engagement person. I actually knew kids that went to that school, but I had good relationships with them. So I worked with that school. I started working as a liaison officer at this campus that actually had an alternative school on campus. Well, this alternative school was for people with mental issues, not I won't say mental, but emotional issues. We'll say emotional issues that they were dealing with. And once I started working there, they were self-contained within the campus on their little area. Whenever they acted out, the threat was if you act out, we're going to send you to the behavioral school, out of the emotional school. Why do I share that with you? Talking about equity. The behavioral school was all Black kids. The emotional school was all white kids. And having worked in both of those, these are both kids that got the same challenges. But the kids of color were perceived as being behavior problems, not kids with emotional problems that were provided with emotional resources. They were pretty much locked down because of their behavior. So I always speak from an equity lens, and that's something that I personally see. Now, have those things changed in those environments since then? They very well may have been, but that's something that I personally noticed. So when we talk about providing resources, from my standpoint, they need to be provided adequately but equitably.
That is a great tip. We're always trying to push equity in resources and messaging as well. I appreciate that. What direction do you see safety in schools? Do you think there will be more or less of a police presence in the future?
You know what? That's going to depend on each school has its own values. I worked as a subject matter expert for the school district in Arlington, Virginia, not Texas, but Arlington, Virginia. They voted to get rid of their school resource officers. And while evaluating that, they voted it out. But afterwards, they asked for a study to be done, and I was called in as a subject matter expert. And in doing interviews, hearing from the schools, there were mixed messages. There were some schools that loved their school resource officer because they had a good one. They had a good one that interacted with the kids. They were part of the community. The ones that didn't want school resource officers were the guy that would come sit in his office all day. He might come out during passing periods or at the end of the school day, but he had no interaction with the kids and had no relationship with anybody in the building. So each environment looks for different things. If you come to schools out here, I venture to say that if you ask most parents, they love the liaison officers being in their school. Most of them, they love it because they don't have those incidents and not on a scale enough to make a difference. So it's going to depend on the environment.
Great answer. I echo that, Chief. My son is in high school, and the resource officer that he talks about the most is the one that spends the time and talks to him about the sports. Did you see that game the other day? He just gets on their level and then it engages with them, and they respect him and they trust him. So that's how he's very successful in reaching them. So I agree with that. Another question, do you think the school resource officer or school nurse should perform drug impairment assessments?
So I don't think any school resource officer should do so. The school resource officer should only do enforcement type things in the case of an emergency. So the liaison officer or school, and this is my opinion, because they don't want to be looked at as the enforcement person, even though they're there for safety. If there's something that needs to be done, and it's got to fall into law enforcement. If it's something that a nurse can't handle and it needs to fall into law enforcement, they need to call somebody from the outside, whether it be arresting somebody. Like I said, unless there's imminent danger, that school resource officer or the liaison officer should not be that person, because they're in that school every day. And now, if you're the one marching somebody out in handcuffs or giving field sobriety tests and stuff like that, that's how they're going to start looking at you more like the police and not part of the community. Even though you are a law enforcement officer, it's going to put a wall up with some people that you might not want that wall to be there for.
That's a great tip. We just have a comment in the chat. Thank you so much for sharing your experiences. We appreciate that. Along the lines of your experiences, I've sat in some committees with you, and I know that you are big on restorative justice with youth. Can you speak to that just a little bit?
Well, it's about being holistic in our approach and utilizing all the tools on the tool belt. And restorative justice is about the community, and it's about the person. It's not just throwing the person away, but it's holding the person accountable, but holding them accountable to those that they've wronged. And so restorative justice is part of, that's one of the tools in the toolbox, and it's a big tool in the toolbox that we want to make sure that we're utilizing. And there's some people, oh, this old kumbaya, we don't want to do all that. And okay, well, how's what we're doing work? How's what we're doing right now working for us? While there's no one answer to solving all these things. If we work together and use the different things that we have, we can move forward. I just sat on a panel with Cook County Commissioner Donna Miller and um, Judge Evans, presiding Judge Evans. They are opening up the first restorative justice court outside of Chicago in Cook County, and it's going to be in Sauk Village. And so I sat on a panel with them for the grand opening of that about 2 weeks ago. So that's a move in the right direction, and that's about the community taking responsibility of those that live in their community.
That's amazing. I love that innovation. I can't wait to hear more about it. Thank you so much, Chief Davis. We really appreciate it. I know that we could talk all day about this because there's so many different questions and so many different facets to it. But I'll just take a moment to see if there are any other questions anyone would like to put in the chat or unmute themselves before we let everyone enjoy their long weekend. I'm sure Chief probably is not off on Monday.
No.
We'll be off for you.
Yeah, that's one of the things I miss about not working in a school. So.
Yeah, appreciate that. I don't see any more questions, but again, we are so blessed to have had you. We were lucky, and thank you so much for volunteering to speak to us. And I know I'll see you soon. So we have some meetings that we attend together, and I look forward to seeing you more in the future and sharing any more information that we have about restorative justice, school policing, school resources, and how to just serve our youth and as well as serve our school staff. We appreciate that. Thank you
for
so
having me.
much. Thank you. And thank you everyone for joining. If there are no more questions for anyone who presented, we are going to enjoy our 3-day weekend and let everyone go. And I appreciate you all for taking the time out of your busy schedules to join us. Have a great weekend. Thank you. Be well.
Thank you.
Thank you.